We have now administered more than 124,000 doses of vaccine in our province, and about 32,700 Albertans have been fully immunized with 2 doses. Over the last 24 hours, we identified 195 new cases of COVID-19. We completed 7,003 tests, and our positivity rate currently stands at about 3.2%. Looking to schools, there are currently active alerts or outbreaks in 315 schools, or about 13% of schools in the province. Currently, these schools have a combined total of 866 cases since January 11th. Since January 11th, in-school transmission has likely occurred in 77 schools. Of these, 61 have had only 1 new case occur as a result. In total, there have been 115 cases of in-school transmission since school went back in person. It's now been 4 weeks since all grades returned to in-person learning, and we've been keeping a close eye on the number of cases identified in school-aged children and youth. The week before in-school classes returned, we saw an average of 131 new cases identified each day in Albertans between the ages of 5 and 19. In the first week of in-person school, that dropped to 113 new cases a day and has continued to decline ever since. Last week, we were down to an average of 58 new cases each day in that age group. While any new case is concerning, this is a positive trend. It continues to show what we have seen here in Alberta since in-person learning began in September. Cases rise and fall in children and youth as the rates of community transmission increase and decrease. When combined with the other evidence that we are seeing, this tells us that schools are still not a primary driver of COVID-19 transmission when appropriate measures are applied. The measures in place to minimize spread in our schools are largely working, thanks to the efforts and attention of our teachers, staff, and students. However, it remains crucial that we keep transmission low and our case numbers falling. That is the best way to protect schools, continuing care facilities, and the rest of society. Currently, there are 427 people in hospital, including 78 in the ICU. Sadly, there continue to be lives lost from COVID-19. Over the last 24 hours, 12 new deaths have been reported to Alberta Health. My sympathies go to those grieving the loss of these individuals and to anyone who has lost someone they love, no matter the cause. I know that many Albertans continue to have questions around the variant cases that we are identifying. We have detected 1 additional variant case, bringing the total to 104 in the province. Of these, 97 have been B117, the strain first identified in the UK, and 7 have been 501Y-V2, the strain first identified in South Africa. I know there are concerns about one of these more contagious variants becoming the dominant strain in the province. This is a serious worry for me too. However, I also think it is important to keep the new numbers that we report in context. It is important that Albertans understand what these numbers mean in terms of the spread we are seeing. For context, the first variant case in Alberta was identified retrospectively in a sample originally taken on December 15th in a returning traveller. From that day to now, there have been 104 positive variant cases identified among all the samples that have been taken. At the same time, more than 43,000 cases of COVID-19 were detected in our province. This means that variant cases made up 0.25% of all the cases identified from December 15th onwards. More recently, since our lab has begun testing most, if not all, positive samples, the average percent of all cases that are variants of concern is higher at 1.4% of all positive tests. Specifically, between January 30th and February 5th, there were 38 variant cases and 2,703 non-variant cases. This does not in any way minimize the threat that these variants pose or the impact they will have if we let them spread widely. However, so far, variants are still very rare and we are working hard to try to keep it that way. We have worked to expand our testing capacity, create dedicated variant contact tracing teams, and move rapidly to isolate variant cases and prevent virus spread. Even more important are the public health measures and precautions each of us must keep following every day. These are the tried and true habits we have created over the past year. Simple steps like staying home if sick, getting tested, and following the letter and the spirit of the rules in place are still our most effective protection. The more we can all keep finding alternatives to close in-person interactions, the safer we will all be from any strain of COVID-19. Alberta is up for that challenge, but we all must continue working together to stop the spread and keep each other safe. Thank you, and I'm happy to take questions.
All right, we'll go to the phone now. Operator, could you put through the first caller, please?
First is Kevin Nimick with CTV.
Hi, Dr.
Go ahead,
Hi,
Kevin.
Dr. Hinshaw. Excuse me. Hi, Dr. Hinshaw. I have a question for you and a follow-up after your answer. The Alberta Federation of Labour calls the decision to ease restrictions right now reckless and irresponsible. Given the rise in variant cases in Alberta, how many variant cases do we need to see before you put a pause to the reopening plan? Is there a solid benchmark?
The important thing that we are watching closely is how our cases are trending, whether our cases are declining, whether they're starting to rise. If we start to see more variants, there is, of course, a greater risk that our cases may start to rise, but there is no specific variant benchmark, because what is most important is that we keep our COVID cases trending down, which in turn means our hospitalizations and ICU numbers continue to trend down, as do our COVID deaths.
Kevin, we only have time for one question each at this time, but feel free to join the queue, and if we run out of questions, we can get you in for a second. Operator, could you put through the next caller, please?
Next is Julia Wong with Global News. Go ahead, Julia.
Hi, Dr. Hinshaw. Just to follow up on benchmarks, last week you mentioned how benchmarks for specific metrics, such as case counts, had not been decided yet. Is there an update on whether benchmarks have been determined? If so, what are they? And if not, how come that hasn't been decided yet?
Again, the important thing is the trends. So if our cases continue to trend down as they have been, that is an encouraging sign. And we need to continue to have cases stable or trending downward in order to continue that path forward. With respect to specific metrics, again, it's really important that we're looking at the context of what trends we're seeing. And at the moment, the trends continue to be encouraging. So when we watch that, if we start to see our cases beginning to rise again, that would obviously be a very concerning trend if we're starting to see growth. And we need to remain nimble so that we're able to determine if that growth is localized or widespread and how that would impact any need to either pause our forward movement or perhaps enact more strict restrictions and go backwards in our progress.
Operator, could you put through the next caller, please?
Next is James Keller with the Globe and Mail. Go ahead, James.
Hi, Dr. Hinshaw. I've got a follow-up to Health Canada approving the Pfizer vaccine at 6 doses per vial instead of 5. You've previously said that staff can get that extra dose 75% of the time under the best-case scenario, but Health Canada says there's consistently 6 doses with an added buffer, and they provided some numbers they used for those calculations. So can you explain how health officials here have come up with that 75% figure? Is it still accurate? And what do you make of Health Canada's own data that seems to say actually you can get 6 doses in pretty much every vial?
The experience we've had to date has been using different types of syringes. So a typical syringe used for immunization would be 3 milliliters. There has been a shortage of the 1 milliliter or 1 cc syringes that were used when we were able to get more 6 doses out of each vial more frequently. What is really encouraging is that we have worked together with Alberta Health Services to be able to procure, and also with Health Canada to be able to procure a different type of that small volume syringe that also has low dead space. So it's a very specific technology. And with that particular technology of the low dead space small volume syringes, that will enable us to pull the 6th dose out more regularly. And again, those syringes were not in large supply previously, which impacted our ability to previously pull out that 6th dose in a consistent way.
Operator, can you put through the next caller, please?
Next is Jesse Weisner with Global TV. Go ahead, Jesse.
Hi, Dr. Hinshaw. In relation to the vaccine as well, in regards to the change about doses in the Pfizer vaccine vials, how many 1cc syringes does AHS currently have? How quickly will AHS be able to distribute these specialized syringes to vaccination sites? And how quickly can immunizers be trained on how to use them?
Some of those specific questions about the exact number in inventory and the exact timelines would be better referred to Alberta Health Services. What I know is that we're working with Alberta Health Services and with Health Canada, who have made, I understand, some conditions on the approval for the 6th dose to have training made available and to have the assistance of manufacturer with respect to procurement of these specialized syringes. And so it's my understanding that Alberta Health Services is working as quickly as possible to ensure all their immunizers have the appropriate training and that when the low-dose syringes arrive, that they are distributed across the province as quickly as possible. But again, specific numbers and specific timelines, Alberta Health Services would be best positioned to answer those questions.
Operator, can you put through the next question, please?
Next is Jennifer Lee with CBC. Go ahead, Jennifer.
Hi, Dr. Hinshaw. Thanks for taking my question. I'm wondering if you can provide an update for us today on coronavirus variant cases in schools. So how many have you identified so far? Has there been an increase, I guess, since last week? Have you found any evidence, any cases where there's been transmission within the school? And, you know, there are calls for health officials to be more transparent in terms of where these cases are happening. Is that something you're open to considering in terms of alerting all parents in a school and alerting the public when these cases happen? And if not, what's your rationale for that?
At the moment, there are 6 different classes in 5 different schools where there has been a potential exposure, where a student has attended while infectious and was later identified as a variant of concern case. Alberta Health Services has followed up with all of these locations, has offered double testing to all of the students in those classes, and in some cases, their household contacts when there has been a delay based on the timelines of testing. And to date, there has been no in-class transmission of variants of concern that has been reported to me. And so I think with respect to the question about why we would not disclose specific schools or specific locations, it's because based on our current information to date, and we continue to monitor that, but on current information to date, it appears that the precautions that are in place in schools are protective against in-class spread of these particular viruses, and we will continue to monitor that. But at this time, there's no reason to believe that other students in the schools that aren't identified as a contact or others around those schools have any additional risk from these particular cases.
Operator, can you put through the next caller, please?
Next is Rafi Bujikanian with CBC. Go ahead, Rafi.
Hi, Dr. Hinshaw. I believe in yesterday's numbers, it appeared that about half of the total variant cases were not linked to travel. I'm wondering if you can provide a proportion of the total now, the 104, and tell us whether that has any impact on slowing down reopenings or not.
I don't have the specific proportion. It is slightly less than half from the last couple of days that I've looked at that data. But it's important to note that those particular cases, some of them are linked to each other. And so we have had some cases, for example, with household transmission. In some cases, as I had mentioned previously, there were several cases linked to a particular daycare. And so it's not to say that all of those cases where they're not linked to travel are independent single cases that indicate completely different sources of spread. So we're working right now to do an analysis of all of those cases with the linkages and the patterns to be able to identify what some of the commonalities may be. That's not yet complete, and it does rely on the detailed investigation work that Alberta Health Services is doing with each of these variant cases and their contacts. And with respect to that question about reopening versus not reopening, I'll reiterate that the important thing that we need to focus on is that variant cases and non-variant cases continue to decline overall. We need to see a decline in COVID-19 transmission, stable or declining new case rates, and whether or not, again, we're concerned about the former strain of COVID-19 as well as variant strains, and making sure that we're doing everything we can to prevent variant strains from becoming dominant, and also focusing on having an overall reduction in transmission across the community.
Operator, can you put through the next caller, please?
Next is Lauren Poland with Global Calgary. Go ahead, Lauren.
Hi, Dr. Hinshaw. Thanks for taking my question this afternoon. I just have a follow-up from yesterday. Have you been able to confirm how many new variant cases are being treated in hospital? And if you don't have that exact number, do you have even a ballpark? Is it a handful or a dozen? And you also said that learnings from previous hospital outbreaks have been applied, but none of those reports on hospital outbreaks have been made public. So can you expand on what was learned and what was applied, and how cases spread within hospitals, and what's possibly being done to try and mitigate that with the variants?
Sure. So I don't have the specific number of how many variant cases are in hospital. As you can imagine, status of cases change on an ongoing basis. So we may have a variant case reported to us one day, they may be at home, and then perhaps several days later they need admission to hospital, or vice versa. So that number would change on a regular basis. With respect to the total number that were reported while they were in hospital, it's a couple. I don't have, again, the specific number, but in terms of order of magnitude of those that I'm aware of, it's around that ballpark of 2 or 3, which again is only those that were in hospital at the time that they were reported to us. With respect to hospital outbreaks, we know that COVID-19, whether it's the variant or the strain that's currently dominant, if we have people who are infectious and sharing a room, for example, there can be transmission within that room. And so one of the things that has been implemented is to make sure that the use of multi-bed rooms is limited to those where there's been assurance that, again, there's no infectivity. It's making sure that the restrictions and the appropriate precautions, PPE, is worn on a regular basis, making sure that healthcare workers are reminded that throughout their entire shift, PPE, again, is worn. And quite frankly, this is something we've seen in pretty much every workplace setting, is that often people use all of the appropriate precautions when they're interacting with a client or a customer, and then there may be a relaxation of those precautions when they're spending time with coworkers. So in no way is this to indicate that health workers are different. This is something we see across all workplace settings. And so again, that consistent reminder that when two people are close together without masks, that there is an opportunity for viral spread, and that kind of consistent use of masking, continuous basis, does need to be applied in all settings, whether it's healthcare or otherwise, so that the virus does not have a chance to spread.
Operator, can you put through the next caller, please?
Next is Emily Mertz with Global News. Go ahead, Emily.
Hi, thanks for taking my question. I'm just wondering, due to the supply issues with the vaccine, have any Albertans who received the first dose missed that 42-day window for their second dose?
If that has happened, it has not been reported to me. I know Alberta Health Services was doing everything they could to get second doses to people within that 42-day window. So I'm not sure. Again, if that delay has happened, it hasn't been reported to me.
Emily, we can check with Alberta Health Services and get back to you offline. I see there's 2 more in the queue. Could you put through our second last caller, operator?
Yeah, we got 2 follow-up calls. First is Kevin Nimick with CTV.
Hi, Dr.
Go ahead,
Hinshaw.
Kevin.
Hi, Dr. Hinshaw. You've received several questions today asking for data on the COVID-19 variants in Alberta. Why isn't that data just publicly available so everyone can understand what's happening?
This week we will be posting a breakdown by zone of all the variant cases, and we will be doing daily updates of variant cases starting this week because we know there is a keen interest in understanding how that changes over time and how it's distributed in a geographic way. So I believe that that will be going live today, and we will be updating it on a weekday basis going forward.
Operator, could you put through our final question, please?
James Keller with the Globe and Mail. Go ahead, James.
Hi, Dr. Hinshaw. Thanks for entertaining a follow-up. You said that with the correct syringe supply, we'll get the 6th dose more consistently or regularly. What does that mean? Is it going to be higher than 75%? Do you expect to be able to get that 6th dose closer to 100% of the time? We're hearing from health regions in Ontario, for example, that say they're getting a 6th dose basically in every vial, and they've even been able to get a 7th dose about half the time. So I'm just wondering where we're at in terms of what you expect, how often we'll get that 6th dose.
It's my understanding that when these very specific low dead space or the low dead volume syringes are used, that it is more reliable to get the 6th dose when those types of syringes are used. So I would expect that, again, I don't know what percentage, we'll have to see. There's always some potential wastage, but I would imagine it would be much closer to 100% based on the trials that Health Canada has reported to us. And so again, I'm really encouraged that we are getting a supply of those particular syringes, as that will be key to our ability to get 6 doses from every vial consistently.
Thank you all for joining us. Dr. Hinshaw will provide another update tomorrow afternoon. Have a safe night.